This is my student support system. Keep watching, keep learning.
The teeth are the hardest substance of human body. Besides being essential for chewing, teeth play important role in speaking also. The teeth are embedded in the alveoli or sockets of alveolar ridge of the mandible and maxilla. Babies are born with two sets or dentitions that are temporary or deciduous and permanent teeth. At birth, teeth of both dentitions are present in immature form in the mandible and maxilla. Temporary teeth, also known as deciduous teeth or milk teeth, temporary teeth begin to appear at the age of 6 months. There are 20 temporary teeth and these are replaced by permanent teeth from about the age of 6 years. They start replacing. There are 32 permanent teeth. 6 are located in the maxilla, means upper jaw, and 16 are located in the mandible or lower jaw. Types of teeth. There are 4 types of teeth depending upon shape and function. Number 1, incisors. The 4 front teeth in both upper and lower jaw are called incisors. Their primary function is to cut the food. The 2 incisors on each side of the midline are known as central incisors, and the 2 adjacent teeth to the central incisor are known as lateral incisors. Incisors have single root and sharp incisional edge. This one. This is root, this is incisional edge or cutting edge, we can say. Next are canines. There are 4 canines in our oral cavity, 2 in the upper jaw and 2 in lower jaw. They are behind and adjacent to the lateral incisors. Their main function is to tear the food. They have a single pointed cusp or edge here and one single root. They have longest root of any tooth. Premolars. These teeth are located behind and adjacent to the canines and are designed to crush the food. There are 8 premolars in the oral cavity. There are 2 in each quadrant of the mouth. These teeth can have 3 to 4 cusps or edges. The maxillary first premolar have 2 root and remaining premolar have a single root. There are no premolars in primary dentition. Molars. The most posterior teeth in the mouth are molars. They have broader and flatter surface with 4 to 5 cusps or edge on upper border. They are designed to grind the food. Mandibular molars typically have 2 roots. Maxillary molars have 3 roots. There are 12 molars in the permanent dentition with 3 in each quadrant. The primary dentitions have only 8 molars. Structure of the teeth. Although the shape of the different teeth vary, the structure is same and consists of the crown, the part which protrude from the gum, white colored, the root, the part which is embedded in the bone, and neck, slightly narrowed region where crown merges with the root. In the center of the tooth, there is a pulp cavity containing blood vessels, lymph vessels, and nerves. The surrounding of this is a hard ivory-like substance called dentine. Outside of dentine of the crown is a thin layer of very hard substance called enamel. The root of the tooth, on the other hand, is covered with the substance resembling to bone called cement, which secure the tooth in its socket. Blood vessels and nerve pass to the tooth through a small foramen at the apex of each root. Here you can see the structure of tooth. This is crown covered with enamel. This one is dentine. Here it is the neck, this one, and this is root, and this is bone. Okay, so this is the structure of tooth. This is a pulp cavity.
My student support system. Keep watching, keep learning.